Hello friends, in this video we are going to discuss about an MCQ related to the medicine subject, and the system is a cardiovascular system. In this system we are going to study an MCQ, a basic MCQ, and then we will go forward with an advanced MCQ. So first question is isovolumetric relaxation phase of the cardiac cycle ends with what? And your options are peak of C waves, which is in JVP, opening of the AV valve, closure of the semilunar valve, and the beginning of the T wave. So when the left ventricle has already pumped the blood into the aorta and right ventricle has pumped the blood into the pulmonary trunk, now the ventricle needs to accept the blood. So for accepting the blood, they need to reduce the pressure inside the ventricle. So they are into the relaxation phase. That is the isovolumetric relaxation, in which there is a no volume of blood is going out or coming in. Only and only the muscles of the left ventricles are relaxing. So during the isovolumetric relaxation, which means these left ventricle or the right ventricle, they are reducing their pressure. Until what time? They will reduce their pressure until their pressure falls below the atrial pressure. So as soon as their pressure falls below the atrial pressure, these valves actually open up. Onto the right side there is a tricuspid, and onto the left side there is a mitral valve. Both will open up and the blood will start coming into the left ventricle as well as the right ventricle, and the isovolumetric relaxation phase ends. So we easily get the answer, isovolumetric relaxation phase of the, so as soon as the valves, AV valve opens, this phase actually end up. So we can also see why the other options are not there. So when will be there will be appearance of the C wave. So C wave actually appears when there is a cusp bulging. Which cusp bulge? So the mitral valve and the tricuspid valve. So it appears when there is a opening, isovolumetric contraction actually ends, right? So as soon as the isovolumetric contraction, which is the opposite of the isovolumetric relaxation, when it will appear? So into the heart, when the ventricles need to pump into blood into the aorta, or right ventricle need to pump into the pulmonary trunk. So they need to increase their pressure more than the aorta or the pulmonary trunk. So they are contracting, and as soon as the pressure becomes above the aorta, and the isovolumetric contraction phase end, and at that time there is a flowing blood outside, and at that time there is a these valves, mitral valve as well as the tricuspid valve, they will bulge, and we record the C wave over here, right? So at the end of the isovolumetric contraction, we get the C wave. So it will also be not there. And closure of the semilunar valves. So when the semilunar valve close, so here as soon as the ventricle starts relaxation, that means the beginning of the isovolumetric relaxation. So into the isovolumetric relaxation, as the isovolumetric relaxation phase start, there is a S2, right? So second heart sound. So as soon as the ventricles start relaxation, blood will start going back and these valve close down. So S2, which actually heard at the beginning of the isovolumetric relaxation, not at the end of the isovolumetric relaxation, and the beginning of the T wave. So into the T wave, actually it is the part of the electrical activity of the heart. Into the ECG, T wave appears where? So we always remember electrical activity precedes the mechanical activity. So ventricular relaxation. So as soon as the ventricular relaxation start, this is the this space, isovolumetric relaxation. Just before there is a appearance of the T wave. So electrical activity always precedes the mechanical activity. So T wave appears actually before the isovolumetric relaxation. That's why these isovolumetric relaxation phase of the cardiac cycle ends with, then the answer is the opening of the AV valve, because the peak of the C wave will not be there, closure of the semilunar valve and the beginning of the T wave are not the answer. MCQ, during the cardiac cycle, the opening of the aortic valve takes place at the opening of the aortic valve. So we all know, into the heart, when these aortic valve will open up. These valves will open up only when the left ventricular pressure will go above the aortic pressure. So aortic pressure, which is fluctuating between the 120 and 80 into the normal healthy person. Left ventricular pressure, which can go from 0 to 120, 130 also. So when there will be the opening of the semilunar valve, or you can say aortic semilunar valve. So as soon as the left ventricular blood pressure which will be more than the aortic pressure, so that's a isovolumetric contraction. So it is at the end of the isovolumetric contraction. So after the left ventricle has received the blood, diastole has been completed, the ventricle starts contraction. At that time, these valves are also closed and these valves are also closed, and the ventricle build the pressure inside it, which is known as the isovolumetric contraction. As soon as the pressure is more than the aortic, it will start pumping up the blood, and there is opening of the semilunar valve, and that is the end of the isovolumetric contraction. So that is our answer. So that's all about these two cardiac cycle MCQ. Thanks for listening.